Stop doing it. We're recording, Mom.
Okay.
All right, hello guys. So I have a guest today. So this is my mommy. Say hello, mommy.
Hello.
So this is my mom. Her name is Michelle. So we're gonna talk to you a little bit about breast cancer because, of course, as many of you are out there, I am personally affected by breast cancer as well. So my mother here is a breast cancer survivor. How many years is it? 24-year survivor. So we're going to kind of take you through that journey and kind of give you some insight as to like what that looks like and how it all acted. I mean, not acted, but how it all came about, I guess. Because it wasn't a typical kind of discovery, to be honest.
No.
So with that being said, we're on camera, Mom, but just so you guys know, I did not prep her for any of these questions. So she is seeing these questions. Did you get these questions?
Yes.
Okay. That's fine. But she's got the questions, but I personally did not talk to her about it because I was like, it's my mom. I'm just gonna ask her questions. It's fine. All right, let's do it. You ready?
I'm ready.
Okay. All right, Mom. So tell me, or tell them, at what age were you diagnosed?
40.
So
I was
you
40.
You were 40. Has anyone in our family ever been diagnosed with breast cancer?
Yes.
Okay.
I found out after I was diagnosed that your great aunt, which was my dad's sister, my Aunt Lucy May, at the age of 26. She was.
I didn't know Aunt Lucy May had breast cancer. I think I vaguely remember you telling me about
Yeah, she
this.
called me after Daddy told her that I had breast cancer.
Uh-huh. She was young too then.
She was very young, and I remember her telling me, she says, baby, just go ahead and do what they say do, because medical technology, they're not going to butcher you up like they did me.
Right.
Because
Aunt Lucy May lived till she was 80 something.
87, something like 88. Yeah.
Okay.
Yeah. And so with those words, that's the first time I realized someone in the family was diagnosed with breast cancer.
Yeah.
That's why it's important to talk about family history, medical history.
Right. So I vaguely remember this, but now it will be forever ingrained in my head now. So Aunt Lucy May had breast cancer. Okay, so you were 40.
Mm-hmm.
Now, do you remember the stage? And y'all, my mother is so thorough, which is hilarious because she brought me like her old report. I don't have it right here in front of me, but it's over there on the table. And she brought me her entire report. So I can kind of walk you through it a little bit in a second. But do you remember the stage at which they told you? Was it like stage 1, stage 2?
It was stage 1.
Okay. So they caught it fairly early, or really early, to be honest.
Yes.
Okay. We're going to get into how we did that in a second.
Okay.
And then, so let's do that now, okay? So let's kind of walk through your journey. I know the timeline because I've looked at the report.
Okay.
But let's kind of go through it, and you'll speak as the patient, and I'm going to speak as your daughter.
Okay.
And, okay, so what happened? Tell me what happened. And how you even got to the doctor as far as, like, breast cancer.
Okay, so because fibrocystic breast ran in our family, and I have a sister, and at the age of 17, she was always going in getting biopsies because she had very lumpy breasts. That's what they called it back in the day.
Mm-hmm.
And so at the age of 35, I went in for my exam, and I had found like a quarter-size fatty tissue. I didn't know what it was, so when I went in to the doctor, he says, well, let's just get an exam. Let's do the exam.
I'm going to take a pause. Can we just say that we won't say his name? If you guys would like to know in the Atlanta area, we will be more than happy to share who it is. But that physician, we still go to that physician today.
And
That's
he's
still
so
office.
Great.
Yeah.
He's
So she
great.
still sees him in particular. I, of course, see the nurse practitioner. And she has seen the nurse practitioner as well. But that physician is still very much involved in our lives. And knows my mother very well because it's been at this point like 30 years, I think, that you've been going to him. So, okay. So you went in, you had a lump because you had fibrocystic breasts, which just means lumpy breasts, guys.
Right. And so after I went in to have the exam, of course, he scheduled me to get a biopsy. So during the biopsy, there was a visiting, well, what are they called? Intern.
I read the report, so I know what you're talking about.
Intern. And so, of course, the lump was still bumpy. It had fatty tissue. And he says, well, to ease my mind, I need to take a sample of the fatty tissue underneath the scar tissue, because I had scar tissue. And I said, okay. Well, when the report came back from Vanderbilt, that's where they found the cancer. It was underneath the scar tissue. It wasn't a normal touchy feel. It was the biopsy he took from the scar tissue underneath.
This is the part that I've always heard as the daughter. It was because the provider was so thorough. And so when I'm talking to you all and I'm talking about going the extra mile with your patients, this is the kind of stuff that I'm talking about, because I'm saying it from a place of not only being a clinician, but as a daughter to someone who has a mother who has been diagnosed with something that could have potentially been very serious because someone went the extra mile. So this was about a month in between, according to the report. So it was November of '98, where you went to Dr. Taylor, and we went and she got evaluated, and he said, "Let's do the thing." Now, was it a annual mammogram?
It was
just a regular run of the mill.
Yes.
So okay. Because we had fibrocystic breast, so we knew that. But then we did the mammogram because he said, that's what we need to do. And then that following month in December is what it looks like, is when you had the biopsy, because they moved pretty quick, right?
Right.
Okay.
But can we back up?
Yeah.
So that was in December.
Yes.
In October, I worked for a large telecommunications company. I had changed my medical to go to Kaiser.
This I don't know.
And so when they came back and told me that I had cancer and what we needed to do, my surgeon, who's also excellent, you had him also, he asked me, he says, well, when are you going to have the surgery? And I says, well, I don't know now, because I just changed my medical insurance. I said, and it's impossible for me to change. I'm going to have to go to Kaiser, and I'm going to have to find brand new doctors. He says, don't worry about that. And I'm saying that because what I found out in the medical world, they can do whatever they need to do to keep you as their patient. He says, don't worry about that. I'm going to write letters, and I will see you through this thing. And I just want you to know that's exactly what he did. So when they told me it was impossible to switch my medical back over.
Gotcha. So they probably did, just so putting kind of all of it together, what it sounds like they did is they probably did some kind of prior authorization where they were able to keep you as a patient, but also get paid, because healthcare is a business, right? Okay. So they were able to keep you as a patient, but had reason to be able to kind of, I guess, write into the insurance essentially, and say, we're going to keep her.
Because when I called, they said, absolutely not.
Right. Absolutely. That is the normal answer that you would get as a patient.
I appreciate him to this day.
Yeah. So, okay. So it was about a month in between this time. We saw something. We got sent for a mammogram. The intern was like, for my comfort, let's go ahead and do a little bit of some further investigating. Thank goodness he decided to do that, because again, this was detected under scar tissue. Do we know why you had scar tissue? You want to share that?
Yes, because I had a biopsy when I was 32.
Okay.
And they took a sample of a quarter. It was about a quarter size tissue, fatty tissue. So that scar tissue is the scar tissue he went underneath and found the cancer.
Okay, gotcha. So because someone went the extra mile and decided that the scar tissue was questionable or wanted to make sure that nothing was there, we discovered stage 1. So now we're stage 1, breast cancer. It is January of 98.
Yes.
And I am in college. So I am, this is the like second year of college. And we, at this point, are 3,000 miles away from each other. I had no idea as her daughter that this was happening or that this was even a thing. So, but let's keep going and then I'll kind of circle back around to that. So, okay, now you're diagnosed. They said you can stay as a patient. What's next? How quick are you moving? Why did you decide to kind of go with your treatment plan that you did? You got to also tell them what your treatment plan is, Mom. But yeah, go ahead.
Well, it happened so fast, Trina. And my concern was at that time, the 49ers was going to be in the Super Bowl. And I did not. 49ers fan, Cali girl will always be. I did not want to miss the Super Bowl.
I'm sorry, guys. I didn't know this part. This is hilarious. Priorities, guys. We are a football family. Priorities, okay?
Well,
are you serious?
They told me 1%.
That's so funny, but okay, keep going.
Just saying. So, my doctor, bless his heart, he called me and he says, listen, that Super Bowl will be there, recorded. You can watch it. So that's when I went ahead and had the surgery like 2 weeks before the Super Bowl.
Gotcha. That is so funny. I'm glad to know your priorities were, you know.
Okay.
Okay. All right. So, okay. So it was basically you got diagnosed and it was pretty quick to having surgery is basically what we were saying, guys. Like there was no, so that sounds like it was like about a month, like
it was pretty much about a month or less than a month
from diagnosis. Okay, so let's talk about your treatment plan. So what options did they give you and what did you decide to do and why you decided to do what you did?
Okay, did I answer the question then?
It's fine, we'll get it.
All right. So the treatment plan, because after I found out it was 1%, after talking with the doctors and what I did was when he told me the stage, and I said, I really don't know what to do. I said, I want to pray about it. I said, but if it was your daughter or your wife, what would you do? He said, I would have them have the bilateral tran. And he said, what I would do, because it's so early, and most of the time when it's early in one breath, if you don't take care of it, it will eventually move over to the other breath. I didn't understand that, but he was the doctor at the time, and I said, okay.
I'm gonna even stop you there because in your report, it was found in the left breast. In your report, there says that in the right breast that there was a mass.
Okay.
It does not say that it was cancerous. Y'all, she handed me the report and was like, I'm glad you understand how to read this. And this was my first time seeing this report. But that's what it says.
Okay.
It says in the left breast, they had already diagnosed you with that cancer in the left one. And in the right one, there was a mass.
So what we did was, I had a full mastectomy, which was a bilateral tran. And that was very traumatic for me because I had never been in a surgery like that and I didn't know what to expect. But this is what I do know. As a woman, breast didn't make me. So I was like, take the breast because I want to live. I have a child I want to see her graduate, and I want to see my grandkids. So what we did was we set up the surgery, went ahead and had the surgery. At that time, I had the reconstruction surgery the same time. My surgery took 7 hours.
Yeah.
And what I never prepared my mind to accept the fact that I would not have feelings in my breasts after that happened. That was years ago, so technology is totally different. I know there's a lot of information for people to know.
It's fine.
But as a woman, I knew breast was not what made me. And so I went ahead with that surgery. What they did was they took tissue from my stomach, because I had a lot of stomach at that time. And I remember my plastic surgeon telling me that what we're going to do is take tissue from your stomach and push it through the tunnel and push it up to make your breasts. I had no idea that's how they would do that surgery. But I'm glad they did it, because now I don't have to worry about wearing a bra. I'm sorry, Trina.
You're fine. This is what they love. It's fine. It's fine. No, okay, so you had a bilateral mastectomy.
Yes.
With reconstruction.
Reconstruction.
Like you went completely extreme, like right off the bat. This is not normal.
Tuck,
yeah.
and my breast was created that
Yeah.
same day.
So this I mean, it was pretty amazing. Like she's very much like y'all, when she first had this surgery, people would want to see and ask. My mom would like, yeah, you want to see? And would like flash her. And I'd be like, Mom, but she, like, no shame. Like, you want to see what this does and what, like, how it all came about and what it looks like now? Sure, I'm going to show you. But now I think about it and I appreciate it. But I used to be like, oh my God. Like,
she's so grateful to be alive.
Yeah, she was.
I was so grateful.
And also, hey, I had a tummy tuck. Like, look at me.
And it's still holding today.
It is still holding. But that's exactly what they do, is basically they remove all the tissue. They perform a tummy tuck and create a tunnel. And they literally, if you've ever seen one, I don't know, like YouTube or like surgery or something, they're literally shoving like this.
Yes.
Shoving the tissue up through the tunnel and creating breast. So you can imagine the pain and
oh
things.
My God, that the aftermath.
Yes.
Oh Jesus.
Yeah.
That was.
I'm sure.
And because of all the pushing and the
all the tugging
and the tugging, my navel had about it exploded because of the pressure.
Right. Because I remember you got like an infection. Or
I got an infection.
Yeah.
I kept smelling the smell that was coming from my lower part. And at the time I was married, I asked him. I said, what do you see? He said, a big hole. I said, what do you mean a hole? He said, you got a hole about that big.
Yeah.
So we immediately went back in, and I had to have another surgery to clean it out, because that was an infection that had.
So they had to debride it.
That's exactly what you said. And what healed that, it was the strangest thing. I was able to see that wound heal from the inside out by pouring saline in it. That's how that wound was.
They just kept telling you to basically irrigate it. So pouring the
Yeah,
saline. They just kept.
He said pour the saline.
They didn't have you cover. I feel like you packed it.
I did pack
like
it.
I vaguely remember you saying.
Good memory.
I know. I'm trying.
Yes. So I had to pack it, but cleaning it out. The first time I actually saw a hole in my stomach, it was like, ooh, gross.
So I guess for me, which y'all, I have never actually kind of talked this through with my mom. So this is the first time this has actually happened, which is kind of cool. Yeah, also with all the knowledge that I have now.
It is. I know.
We've never really
because when you had to remember the tubes that you had for drainage.
Yeah.
you wanted to change, so you were so excited. You
I
was like, Mommy, let me
and
do
I was
it.
nowhere near a nurse, like nowhere near, but always fascinated by health.
You was like, oh, this is cool. And I was like, okay.
Okay. Yeah, so like talking through this and then knowing the terms and being able to be like, oh, okay, so this is what they were doing. Like, it's neat. Yeah. It's neat. Anywho, so I do have a question, and I've never asked you, like, why did you not choose chemo? Because, like, a lot of times if you are diagnosed stage 1, it's very early. Like, most women would be like, I don't need to get cut on. Let's go ahead and do the radiation. Like, why did you choose not to even go that route? Because you didn't even have chemo afterwards.
No.
Like, there was no chemo, no radiation, guys. She had the surgery, everything gone, all clear margins. And just to be clear, they did everything, but they also removed some of the left lymph nodes.
11 out of one.
Yes, 11.
And 7 out of the other. Right.
Right. So they, so she's basically saying 11 lymph nodes out of the left and then 7 out of the right. Again, it was only stage 1. In the report, it says it didn't metastasize, so it hadn't traveled anywhere. They were just being very, very thorough. But why did you not choose chemo or anything else?
Well, because they said it did not metastasize.
Okay.
And then second...
But, like, initially...
Well, initially, I had made up my mind I didn't want to do that because I worked with 3 ladies that did the chemo, radiation, and they end up dying. So that was a fear of mine. And I was like, I trust God. I said, God, you have brought me through so much, and I'm totally trusting you to make sure this doesn't come back. I didn't know that I would still be here 24 years later. Yeah. But I'm grateful that I made that decision.
Yeah. I do remember not seeing you in the hospital because I didn't arrive in time to see you, but I remember all of the nurses, the physicians, everybody saying they were just amazed because my mom had these lymph nodes renewed. She had double mastectomy, had tummy tuck, and she up there, that's how she was in the bed, y'all.
She was in the bed, like
up in the bed with her arms above her head, and like that's unheard of. Like you are not doing that, and you just had your lymph nodes removed and your breast, and she's up in the bed chilling with her arms above her head.
I remember the doctors coming in and said,
like, she should not be able to do that.
Put your arm down. I said, okay. He said, now let me see that. And I raised my arm up. He was like, are you not sore? I was like, no. He said, you're not sore? No.
You're like, I'm just sore from all the tugging and the pulling.
I said, I'm sore down here, but I'm not. He said, oh, okay.
Yeah. Yeah, I remember that story. Yeah. So now there was the story where you ended up on the floor and needed a little bit of help.
Okay, so pain is real. Pain is real. No one told me that once I had the surgery, the nerves, when they begin to connect, you would be in excruciating pain. No one told me that. So one day I decided, I had been laying down, and I decided I wanted to get on the floor and stretch, because to this day I love sitting on the floor. I got on the floor like about 7:30 that morning. I'm sorry, y'all. I stayed there the whole. I could not get off the floor. My stomach muscles, and that's why I appreciate my stomach muscles. I could not get off the floor. I had to wait for my ex-husband to come and get me off the floor, and that was around 5 o'clock.
My mom was on. I had went back to school, so I was back at college, and because she was very.
I didn't have a phone close to me. I couldn't move.
My mom was on the floor, y'all. Like, this could have turned out bad. We're laughing now because obviously, like, she's fine. But she was on the floor for
me and Shay.
You and Shay is my old dog. So you and Shay on the floor. Bless your heart.
On the floor, I couldn't
brace and use the.
I couldn't do it, and that's when I realized how important stomach muscles are.
Yeah.
And we take them for granted, but I couldn't move. And then the other thing that was funny is the first time I was able to take a shower. When the waters hit my back, I screamed like someone was beating me.
Why?
because all of the pulling and the tugging, I didn't realize how bruised up I was.
Oh.
And I screamed because it felt like someone
Right,
had beat me.
right.
And
you weren't prepared for that.
I remember just going in the corner going, ah! But
Oh
I wasn't prepared for that. So they don't tell you.
It's a lot of stuff they don't tell
things.
you. Yeah. It's like giving birth. They don't tell you. There's stuff they don't tell you.
Oh, well, we won't even talk about it.
Okay. So, this is, again, kind of walking through your journey. So, as your daughter, one of the things that, to probably a lot of folks' surprise, is I was not actually told that she was diagnosed with cancer. I am her baby. This is my mom. This is my mommy. Yes. There is only one of her, one of me. So it has been gang from the time I was born. Yeah. And no, I was not told. I had just started college, 3,000 miles away, like I said, about a year and a half ago, like before she was diagnosed.
Right.
I was actually not told until, I kid you not, walking into surgery. Like, I'm having surgery tomorrow. And I was just, what? I'm confused. I don't understand. Because at the time, this is when, like, Susan G. Komen, like, was so huge. And the breast cancer movement was so big. And also, my mom was young. Like, she's 40. And she's being diagnosed. I had no concept. I could not understand what was happening. So I ended up flying back and getting there after she had surgery. So I knew when I landed, basically, I knew she had come out of surgery and she was okay. So when I saw her, she was legitimately transitioning to the house. Me and her had beef for a long time because she did not tell me.
I just wanted to protect you, but I realized that was the wrong thing to do because your grade suffered.
Very much so, y'all. I have no shame in telling you. I made a 0.87 that semester.
It was like from an A student to whoa. And then I didn't think mentally as a child not having any siblings that you would be able to, keep it together and process it. But that's why I'm grateful because your Delta sisters were there for you.
Yes. So I had just pledged. Yeah. Hey, Delta Sigma Theta. I had just pledged, and my line sisters were basically my support. And they supported me while I because I basically flew home and stayed there and then came back to school because she was very adamant that I continue my schooling and my education and that this was not to hold me up. So I begrudgingly,
I know, but you did.
I did. I begrudgingly went back to school. I clearly could not focus and do anything because, again, 0.87 GPA, y'all. So it happens to the best of us.
And the professors were really good once they realized what you
were doing. Because a lot of them were like, what happened? And even Delta Sigma Theta, like to pledge, you have to have a certain GPA. Of course, that tanked my GPA. Yeah. And I did get asked, what happened here? Yeah. And so once I explained it, so blessings for them for giving me grace at that point.
Holla, holla,
for giving me grace at that point because they were able to understand and still kind of see past that, which was really nice. But yeah, I begrudgingly went back to school. I made it somehow kind of through the semester. God is good. And then came back and I nailed it the next semester. I think I got like a 3.9, the next semester. But also knowing
I was still nailing it.
I still thank you, Mommy. And then came back knowing she was fine. Like went home that summer, she was fine, and then was able to go back to school. But yeah, we like for a long time, not angry, but upset. Like, why didn't you tell me? But also now being a mother,
I was just protecting you.
I
felt like that was the best decision.
She thought she was doing the right thing. You thought you were doing the right thing, and I get that.
Because really, what could you do?
Anymore.
When I thought about it,
Yeah.
Well, thank you for not doing that. But when I thought about it, I was like, well, what can she really
Yeah.
do?
Yeah.
Right now, you need support.
Yeah. You're right. Yeah, you're right. There was nothing.
Right.
So with that being said, I go back to school. Who was your support network? Because we know who mine was. Who was your support while you were at home?
Well, while I was at home, at the time it was my ex-husband. And then I had my girlfriend Sheila. And I had just became a member of Salem Bible Church. And I met just a few people One of them was Elder Lillian. She had breast cancer. And my pastor, Jasper, I remember joining there. I was there a month. And I walked up and told him that I wanted prayer. So he told her to come. And he introduced me to her. And so it was a very small circle because I really didn't know people.
You didn't know people, but you also didn't tell people.
I didn't tell people.
Not when you were going through it.
No, because I'm the type of person when I'm going through, I don't say anything.
Yeah.
I get quiet and I meditate and I pray and this is something I've always learned, that it's best to keep it to yourself. Now this is me. I keep it to myself. I pray about it and I journal about it. And as I'm going through it, I can see me coming out of it.
Gotcha.
As I'm writing on paper.
I like that. Okay. So now, knowing kind of all that you know, kind of is there anything you wish that you knew before you had the surgery? Because, I mean, quite frankly, like we said, this went fast. You went from a month to a biopsy to the next month legitimately having surgery. You didn't even have a chance to really
I'm thinking about that question and I can't even answer that. I don't have a question for it.
Yeah, I mean, I think that's fair because you probably were just trying to process it.
Well, let me back up.
Okay.
The only thing I regret and wish I knew, remember our dog Shay?
Yes.
Shay used to come and smell that left breast all the time.
Interesting.
And I used to say, what are you doing? But she would smell it all the time. And dogs can sense sickness.
They can.
I wish I would have paid more attention to that. And in fact, when I went through, Shay, remember, she would not move.
She didn't. That dog.
She would not.
She was a
move.
Spitz, and she never left my mother's side.
She never left my side.
If she could talk, I'm sure she probably would have yelled at her for sitting on the floor.
Because she laid there the whole day.
She did not move from my mother's side.
No, she didn't. She was a good dog.
She was a good dog.
So that was the only thing I wish I had paid attention to, that because dogs sense things. And so that's the only regret. But other than that.
Well, what was probably the most difficult thing then?
The most difficult thing was going through the surgery was learning how to walk again because of my stomach muscles.
Yeah.
That was so difficult. Pulling just a simple thing.
Just to stand up straight.
Sitting on the toilet. Standing up, walking, holding your head up because of the muscles.
You automatically want to kind of come in and
because of the nerve that were destroyed, or should I say cut into. Because I remember when I went in to have that surgery, I was told to leave the wheat alone because it would make everything gel.
Interesting.
And they needed to determine what was what when they would go in for the surgery, as far as the nerves and the intestines and everything. So I don't even really eat bread that much today. But that was the only thing, learning how to walk and learning how to focus. I couldn't focus.
Interesting.
So what I would do for hours when I came home, I would play solitaire.
I was about to say those crossword puzzle book things I used to see all the time.
I would play solitaire, and even just learning how to color in the lines of a coloring book. I would color for hours because I didn't realize how much.
How drained you were, how
so
exhausted.
drained. Yes.
How long did you take off of work?
Oh, I had a good job. AT&T. I was off for a whole year.
I was like, I feel like it was a good amount of time.
Yeah, I had been there almost 20 years, so I had, I was blessed.
Yeah.
I was off for a whole year with no problems.
That's good. That's good. They don't do them like that anymore. So
Nope.
yeah. I think maybe. So, what was your kind of biggest revelation, or the thing you realized coming out of being diagnosed and having surgery? Like, what's one thing you would tell folks?
The one thing I would tell people is to know where your faith is. Who has control of your life? It's not man, it is God. What I tell people is that, like, if you have negative people around you, remove them.
It's a real thing, you guys.
You have to get them
Like
out your life.
positivity and like moving forward. That is a real thing. Confidence, knowing that things are gonna be okay.
I just knew it when I gave it to God. I had such a peace, and I said, "Okay, God, it's me and you. Nobody else can do it." And thank you for the surgeons, because they were just all, they had a belief in God themselves, and each one prayed with me before I went under. So I don't know if you still have that, but that was a blessing.
Right.
It was just that God had put these people in place.
Right.
And everything just worked out. But yes, to this day, negative people, I don't fool
She
with
does.
them.
She really doesn't, y'all. She will call me and she'll be like, "They were fussing too much. I told them not to call me with that mess." And these will be like friends who are 25 years in together.
Right.
And if they just have too much going on, and she like causing her to have anxiety because of their thing, she will absolutely disconnect and cut them off.
Nieces, nephews.
Just for and not cut them off as in never speak to them, but
come back
disconnect.
To me in a different...
Yeah, come back when you've solved your issues. I am gonna pray for you. Amen. Kind of situation.
Stress brings on
It does.
all types of illness, and stress will kill you.
It will.
So I don't want to die until God said, "Okay, it's time for you to come." But I'm not gonna let nobody else kill me with that foolishness.
I hear you. You talking to the choir.
I know. So just remove stress.
Yeah.
Just remove stress, and
as best you can. And it's hard. It's I feel like that's gotten harder in society today.
Protect your peace.
You protect what you value.
I protect what I value. I protect my peace, and I believe that's why I am the way I am today.
Oh. Okay, so what would you say to someone who is newly diagnosed and scared?
Well, being scared, that's the human part.
Absolutely.
But what I would say to someone who is newly diagnosed, just know whoever you have faith in, and when I say that, I believe in God. Okay. So some people say higher being. I know where my faith lies.
And if that for you is unicorn farts and sunshine rainbows.
Surround yourself with peace. Any negativity, that's draining, ladies and men, because men get breast cancer
too.
So just keep yourself grounded and surrounded with positive people. I don't care if it's reading a book, turning off that TV, getting off of social media. Music. I love music. Gospel music, very inspirational music. That is what helps me and has kept me. And having your faith in God. Just don't be afraid to cry out and ask for help. But also know who your support is. If they're not for you, you got to let them go, because your health is more important. And it's draining when you have someone in that circle that won't support you.
And all of your energy should be going to be healthy. Like every single bit of your being. I think from my end of it, having a parent or a family member, how I would support them is one, sometimes things just don't need to be said and you just need to jump in.
Well, family automatically, my family automatically
they jumped in, but
yes,
not everybody's family is great,
right,
and I'm absolutely acknowledging that.
Right.
But if you've got a friend or a family member and you are the support person, like I would have been the support person, my comment or statement to them would be, again, some things just don't need to be said. If the bathroom needs to be clean, clean the bathroom.
Hello.
You know, if food needs to be cooked, just cook it.
Hello.
Sometimes you don't need to just say or even ask, just do. Because again, all of their everything right now is focused on being healthy, and that's all we all want.
Just want to be
And
healthy.
if it's not looking like it's going down the road where things are going to magically work out as beautifully as it has worked out over here, you also want to spend that time with that person
Right.
while you can.
Right.
If you can afford it, hire out. If not, so what? The dishes will be there. Spend the time with the person.
Right.
Spend every moment with that person, because again, the moments are fleeting. I think that's what we realized, is they are fleeting and they go by fast.
And that's what I appreciate about our family.
Yeah.
We are a very close-knit family. We're in different states. But when something goes down,
I know it's all hands on deck.
we're there. and my Aunt Doll, bless her heart, my mother passed when I was 28. So I had an Aunt Doll, a great Aunt Doll, who was my mother's sister. She came in there, and when I tell you words of inspiration, words of encouragement, just to call me and have me crying, laughing, that was so important. And that little lady, I loved that little lady. We lost her 4 years ago, but Aunt Doll was, she was the
She was
rock.
everything, yeah.
She was the rock.
She was. So, I mean, I guess this is our story.
This is our story.
This is our story. So here we are, still going strong.
Yeah.
We've had no instances of reoccurrence or anything. I don't know. She's completely healthy, y'all. She still gets on my nerves. I love her.
Well.
I think that's her job as a mom. But yeah, no, completely healthy. No medications for any reason whatsoever.
Just blessed.
And yeah, we're doing
Just
pretty
blessed.
good over here. But with that being said, I definitely want to reiterate that if you feel something, to go get it checked out. Don't take no for an answer if you know that something is wrong. And maybe you don't know. Maybe you have a wonderful clinician who's going to go the extra mile, like they did for my mom. You don't know. But most of us, I think there's a general undercurrent right now of folks being very in tune with their body and knowing when things just don't quite feel right. And if that's you, please don't take no for an answer.
Never.
No, not every NP is going to be as great as me, or every physician is going to be as wonderful as hers. But I'm hoping for it for you, so that you have a positive, wonderful outcome as well. And no one said it's going to be easy.
No.
It's not. You will have your own struggles.
That recovery is something.
Yeah. I mean, so it will not come easy, but my hope and my hope is that it does, and that it is whatever's supposed to happen for you is supposed to happen. But just remember that. So when I talk to my students who are currently practicing, and when I say go the extra mile for your patient, listen to them. Do the extra things. Explain why you're doing them if they have to pay for them, but explain why you're doing this. This is why. I have a whole nother 25 years I've had with my mother, and hoping for another 25 with her, because someone just went the extra mile because it didn't quite sit right in their soul.
Yes.
We've never seen that intern again.
Never
seen that intern again. Never experienced them. But when I tell you, job well done for them. Knowing that they potentially saved someone's life was and is a fascinating thing. So we'll say a little prayer for him tonight.
Right.
But with that being said, this is my mommy. And so we will talk to you later. But also, Mom, so there's this thing. I mean, they're selling hearing aids over the counter.
Watch it.
Just saying.
Watch it.
So, running joke.
But I'm going.
So I always joke, and if you know me, you know that I always joke about this, is that my mother cannot hear, like she can hear me right now, obviously, but I have walked into her house and the TV is on 50, y'all. Or I have called her and I can hear the TV on like 175.
That is my domain.
I need her to get her hearing checked. Presbycusis, guys.
But I'm going.
You know. So we're selling hearing
I think
aids.
that's a wonderful thing. Because they're expensive.
They are, but they're still expensive. They're still expensive.
That's okay.
I think the low number I'm seeing is still like $1,400, but still very doable.
Yes. But it was just expensive just to go sit and have them.
I know. To do all the testing and all that. So we're gonna go. We're gonna do it. All right, y'all. So it's been real. we're gonna get a hearing aid.
I don't have any shame.
I mean, you shouldn't. Absolutely not.
I can't hear. I want to hear.
There's no
I'm
shame.
nosy.
Bye, y'all.